Brian Carroll, and I'm going on my daily 10-minute walk. Today I'm going to talk about something that came up in the 2021 Virtual Swiss Summit. If you don't know what that is, it's a seminar of presenters and experts in different fields, anywhere from bodybuilding, strength training, um, drugs, supplements, nutrition, the whole nine. And Ken Kanakin is the guy's name from Canada that's been putting these on off and on since the late 90s. I mean, you've had guys like Dorian Yates and Lee Haney present, guys like Brian Carroll, people like that that have done Swiss over the years. Um, this year, due to COVID, well, the ongoing COVID endemic, um, we had a virtual summit that we recorded over the last few weeks. And if you haven't watched it yet, I think the free registration is over. But Ken is someone that I highly suggest supporting in the industry because he's very selfless with what he does. And the quality and level of content that he has is second to none. So if you haven't checked it out yet, go to Swiss. Just Google Swiss 2021. I'm going to put a link below where you can go directly to it. It was free for like the first 5 days, but it's not very much money and you'll get access to everyone's talks. But my talk in particular was about returning from back injury and getting back into powerlifting again, and the niche that I've been able to carve out in my specific field. And if you haven't listened to the talk, I go on to talk about I'm working on getting my master clinician certification from Dr. McGill, and I'm not there yet because I'm not good enough yet, but I'm working on the nuances of image reading and complicated injury mechanisms and such. But with that said, my niche now is more getting people, once they're out of pain, bridging the gap between being in pain and doing the very basics that people can do while they're in pain. And usually it's a bunch of nothing. Walking, core work, removing the cause of pain, of course. The whole McGill method deal. And it's going to be different person to person. But I'm the guy now that people can come to once they get out of pain. Once Joel gets them out of pain. Once Ed gets them out of pain. Once Stu gets them out of pain, then they can send them to me. And depending on what their sport of choice is, especially strength training athletes, I've been able to help a great deal of strongmen, powerlifters, and people that just want to train strength again, even if they aren't competitive powerlifters. I've helped, I don't want to say over 100, but there's been dozens and dozens of people I've helped successfully not just get back to training, but get stronger and succeed back on the platform again. So that's what I talk about. I talk about the progressions that you need in training. It's nothing new that you haven't already heard me talk about before. But during this topic that we were discussing, getting back to training, Ken asked me a very good question about modalities and recovery strategies that someone can use to help maybe expedite the process to recover quicker, not just from a back injury, but just in general. But he asked me, what have I learned through my years in powerlifting to help with recovery? And so I was like, man, that's a really good question because everyone recovers differently. Some people, we all know people that don't like to be touched. So the people that don't like to be touched, they're not going to want to get a massage, much less a deep one or Graston or any type of trigger point therapy. So someone like that for recovery might just be better off doing a float tank or getting a Swedish massage or having their head rubbed or getting a facial or whatever it may be, instead of someone like myself that enjoys being touched and likes a deep massage and that type of stuff. So everyone's going to be different with the recovery. So besides just the normal rest, get enough sleep, proper nutrition, the basics, don't train too hard, don't train too little, have some recovery training sessions on an occasion. But we started talking about some of the peptides. And depending on the legalities in your country, these are kind of gray area supplements. But some of the Sarms, some of the peptides can be greatly beneficial for people. I've known people that have healed very quick from TB 500, from BPC 157, from CJC 295 NODAC, ibutamorin, all these different SARMs and growth hormone precursors or stimulators or whatever it may be. People have done well. So I had a couple of people follow up with questions about BPC 157 and TB 500 for their back healing. And then, of course, this led to deeper talks about PRP, stem cells, and a new procedure that is getting popular. I don't want to say it's new, but it's becoming more popular. It's called a disc seal for people with a annular tear or open fissure in their disc, where basically they go in and use a protein called fibrin, and they go and they take some glue, they put the fibrin in, they seal it up, and that can help expedite the healing. Now, if that's your only pain source, and you can prove that's your pain source, this can be a very successful procedure for some people, because annular tears can be very difficult to heal and be finicky. But with that said, I don't know how much of a benefit these can be for some people. It just depends on what they count as a successful procedure. Now, what I learned from Stu is sometimes with back surgery, a success could be counted as they didn't die, they didn't get worse, they didn't come back, they made it through therapy. Not necessarily that they got better and got back to activities. It all depends on the context of the question. So with that said, I don't know of any magical potions, stem cells, PRP, disc seal, or any of those methods that are absolute guarantees for people to get better. But I encourage people to pursue and research. You know, there's a client of mine that's in Colombia right now that's getting stem cells. I really don't know, because there's not a whole bunch of information and data on how much quicker it could heal a disc. You know, especially if you have multiple levels that you have damage on and you have pain. So do some research. If you do have aches and pains, check out BPC 157, TB 500. I'm not your doctor. I'm not a doctor. I'm not recommending anyone take anything at any time. You make your own choices. And if you feel a food or a supplement or anything in between is appropriate for you, you make the choice and you get it and you use it, and you enjoy the benefits or you suffer the consequences with your choice. So there's always a reaction to anything we put in our body. Might be good, might be bad, but these people out there that make promises to you, especially without giving you a thorough assessment that they can heal you with their stem cells or heal you with their disc seal, be skeptical. You know, each injury is unique and needs a particular strategy, but I have been very encouraged with the two clients that were pursuing disc seal. They haven't got it done yet, but I was very encouraged to see the notes from the doctor saying that you've got to remove your causes of pain and not do anything like bending, twisting, rotating, whatever, if that's one of your pain generators, for up to 4 or 5 weeks after the surgery, and they want you to walk and strengthen your core. So with that said, I'm going to wrap up this talk with a couple thoughts on this. These different medicines, these different protocols can work, but at the end of the day, you still have to rehab. You're still going to have to take time off. And me, not being a wealthy person, I would use the least effective medicine, the least the least invasive method, the least expensive method, and then slowly escalate what you do and what you spend money on. But some people, We've seen it over and over. Some people get better just for taking time off and doing the virtual surgery. That's also another reason why surgeries can be successful for people, because they take some time off and rest, and then they do some rehab. And the next thing you know, their back pain's gone. Maybe in spite of the surgery, maybe because there's a lot of moving parts there, a lot of variables. So TB500, all these peptides, these different Sarms, like MK, what is it? MK2866, MK677, these types of peptides, these types of Sarms can be beneficial. But remember, if you're lifting in a tested federation, or there's a chance you could get performance enhancing drug tested, be careful, because some of these things that may be legally sold on the shelf might be against your federation or your job, or who you are sponsored by, their drug policy. So be careful with that. So do research. There's a really good book that Bill Lillian wrote. He's been writing it for a long time. He updates it every few years. It's called Anabolics, and I think it's $85 for the hardback. I think the latest one he has is 2020 or 2021. This gives you a very good, in my opinion, subjective, because he's not an athlete. He's just spent time, he's a scientist. He spent time studying these drugs and these supplements for a very long time. He gives you the good, the bad, and the ugly. And now that the book has been updated quite a few times, unlike the first time I read it, it has Sarms, it has peptides in it. It talks about some of the studies, the risks, the reward for all supplements. So that's a book I would recommend everyone flip through, whether they want to remain natty their whole life or not. I think it's a good idea to have information, and that way you can just make the choice for yourself. And if you want to take peptides, or you want to take things like growth hormone or something further, because the doctor may one day offer it to you, and you need to know if it's going to be good for you or not, just because your doctor may or may not say yes or no. So do your research, check out those books. There's no such thing as a quick fix, but some of these things can help depending on your injury. But the jury's out with the discs and the spine and everything, with biological compounds, stem cells, PRP and such. So I'll keep you updated on what my clients find out, if they do the disc seal, or when they do the stem cells, or one of them might do the whole combination of stem cells and the disc seal. So I'll keep you updated, and hell, I'm interested to see myself. But on my opinion, if you're getting better, don't rush it. I wouldn't take anything else. I wouldn't add anything in. I just let biology do its thing, and you might save a little bit of cash along the way. So those are my thoughts. Check out Swiss, check out Ken Kanakin, and hopefully 2022 we'll be live in Mississauga, Canada, and we'll be doing it all again in person. And I'm looking forward to it, guys. Talk to you later.
Thank you so much for watching today. Please subscribe, like, and share if you enjoyed this video, and have a wonderful day.